Hi, my name is Rajiv Ricky, and I'm a research scientist on the Health AI team at Google Research. I'm excited to present our work titled Differences Between Patient and Clinician Submitted Images Implications for Virtual Care of Skin Conditions, which will appear in Mayo Clinic Proceedings Digital Health. This work was done in close collaboration with Stanford Medicine. In recent years, driven in part by the COVID-19 pandemic, telemedicine and patient portals have rapidly emerged as popular consultation options for patients seeking quick and convenient medical care. This is especially true for patients with dermatological conditions, as telemedicine allows patients to picture their skin concern and submit them for asynchronous review by the healthcare providers. This can be done at all times of the day as symptoms appear and is more convenient than waiting for an appointment. However, some patients continue to make in person or synchronous appointments. This made us wonder, are patients seeking virtual care a distinct set of patients than those seeking in clinic care? In this study, our aims are twofold. First, using regression modeling, we hope to understand any demographic or clinical differences between patients submitting photos of skin conditions directly to their providers versus those taken by providers in the clinic setting. Second, using deep learning models, we aim to understand any image quality differences between photos taken by providers in clinic versus those taken by patients directly, and relate any differences to demographic or clinical factors. In this study, we retrospectively sampled 2,500 dermatology e-consult cases from Stanford Medicine between November 2015 and January 2021. Out of these cases, 25% had patient-taken pictures or PAT, and 75% had clinic-taken pictures or CLIN. All images were captured using a cell phone. Each case was reviewed by a Stanford dermatologist. Further, a reference diagnosis was obtained for each case by a panel of 3 board-certified dermatologists. Using multivariate logistic regression, we noticed 3 interesting differences between PAT and CLIN cases. First, CLIN cases have a higher fraction of patients who are older than 60 years old. Second, CLIN cases have a higher fraction of patients with darker skin tone measured by the Fitzpatrick skin type scale. Third, CLIN cases had a higher fraction of patients with suspected skin growths or neoplasms. Interestingly, we found no difference in case ambiguity, suggesting that PAT and CLIN cases were equally challenging to diagnose. PAT cases, however, had more intermittent conditions where symptoms came and go, which further underscores the convenience of using asynchronous care. Together, these differences suggest that certain socioeconomic barriers and digital literacy barriers do exist in accessing digital health. Further work will be needed to understand these barriers and ways to overcome them. Finally, we developed a deep learning model to assess image quality factors, namely blur, lighting issues, and the presence of excess background. We found that patients submitted significantly more photographs per case. In particular, younger patients took a lot more photographs than older patients. PAT photos were not focused or blurry and contained lots of background information. Clinicians, on the other hand, took cleaner, more focused photos. PAT image quality varied depending on the condition as they struggled to take photos of diffuse rashes. Altogether, our work has 2 main impacts. First, deep learning methods and patient education can be used to screen images at time of submission. This will minimize the gap between patient and clinician taken images. This will also help reduce care provider workload as they have fewer poor quality images to screen. Second, because CLIN cases had more older and darker skinned patients, barriers to accessing virtual care still exists within the community. Better patient education around patient portals and photographing skin conditions in general can help bring the benefits of virtual care to these communities. Thank you, and I hope you enjoy reading the paper.